Hi everyone, and welcome back to my channel. So excited to bring you guys yet another video where we'll be talking all stuff nursing. This video is for all the nurses out there who've just graduated. You're all super duper excited to get into the clinical area. Are you really? Or are you more like, oh my goodness, what am I going to do? Am I actually fit for this? Am I going to survive this nursing? Listen, whoever you are, you're going to do just fine. I'm going to give you some little tips to help you along on what helped me on my first day as a nurse, and hopefully it can help you on your first day. So let's get into it. Please like, comment, and subscribe down below so that you can keep seeing these videos and I can keep doing these videos for you guys. So you've just finished nursing, you've graduated, you're all like, yes, let's do this. And then it's your first day and you're like, wait, I'm actually going to be in charge of all of these patients. They're under my responsibility. Yes, that feeling can be daunting. But listen, every single nurse goes through this. And guess what? All of us survive it. You'll be fine, honestly. All the junior nurses out there, it's your first day, you walk in, what do? You've got 6 patients that you have, depending where you're gonna be working. You could have 1 patient if you're working in like intensive care unit or coronary care unit. So the max you should have is 6 patients, 6 in a room or in side rooms. You just want to tell yourself, take a deep breath and tell yourself, I can do this. I am a qualified nurse and I've undertaken all the exams and practicals and training that there is needed, and I've passed them. And here I am as a nurse. I can do it. You literally need to like hype yourself up, be like, yeah, I can do this, So first day, you walk in, you look at your 6 patients that you've been assigned. Say for example, one patient has a cardiac history, another patient has a respiratory history, another patient maybe has history of seizures, another patient maybe it's just a social admission, maybe they're not coping at home, and then another patient is young, they probably need to go for surgery there and probably go home the next day. And you just have a quick scan of your patients. You don't have to know everything. I think that's one thing we always get wrong. We feel like we have to just know everything about each patient because like that's what we're supposed to. No, we're not supposed to know everything. We need to know enough to care for that patient throughout the day, and you have the whole day to be able to look through the notes. One advice I would give you in handover, when you're getting the handover from the night nurse, you do need to ask some major questions, like for example, if a patient if they need assistive 1 or assistive 2, if they can take their medications orally normally with water, or if their medication needs to be crushed. In handover, you get a gist of who is your sickest patient and who is your least sickest patient. You want to go to that patient who's scoring a high warning score, who wasn't well last night, who the night nurse said, we have to bring the doctor for this, for that. You want to go to that patient and see, are they actually okay? Do they need my immediate attention? It helps you see, what's the worst that I need to deal with right now, and then I can work my way down. Because that way, if you have that mentality of I need to get the hardest thing done first, best thing, go to sick patient first, see how they're doing. Vital signs are so important. If a patient is really sick, you want to go in and do their vitals, and not just once off and then leave them for like 3 hours. You want to be there and see how they're developing, how they're progressing. If you go in and you do their vitals and their blood pressure is high, the heart rate is high, they're breathing really quickly, you need to make sure that you ring the doctor to come and see that patient, because the quicker the better, basically. Because if they're really sick, you want there to be a doctor to assess and see what the plan is. What I do usually do is I make a plan, and so I put like a list, and I put IV antibiotics, and I see which patient is on antibiotic, what antibiotics they're on. You want that list so that you just have an idea, a plan of what you're going to do. You want to have a list of blood sugars. Who needs blood sugars checked and who needs insulin given? That's one thing that's really important. You want to make sure that your diabetic patients get their insulin on time. That is really important, because otherwise you're going to have blood sugars going sky high, and you don't want that. You don't want that. So have a plan. Have a small list of what procedures. So say, for example, you've got two patients who need to have, one needs to have a chest x-ray and the other needs to have a CT scan. Just put scans or procedures, whichever way works for you, and just put a list there. And that way, throughout the day, you can have a look and be like, okay, this person hasn't actually gone for that chest x-ray. Let me just ring the x-ray department and see what's happening. And that way, you're keeping on top of your work, you're keeping on top of your game, and you're doing good. Time is going by. Do you have very heavy patients? Do you have patients who are going to really need a long time being washed? Or are they kind of a mixture? Do you have patients who can wash themselves, and do you have patients who can actually do things themselves, and then you have fewer patients who need your assistance? In that case, you can go ahead and start the medication. I feel like that is probably your biggest fear. Medications. Giving the right medication, the right dose, the right patient, the right time, all of those rights. You want to make sure you know your 5 rights of medication administration. I think there's now 10 rights. You want to make sure that you're going to the right patient. The main focus on your first day, you want to actually know where the medications are, because you're going to feel that pressure because you're sharing the medication trolley. The nurse next door is probably 10 years in the business and flies through it like this, and you're there going, where's aspirin? Oh, there's aspirin. Take your time. It's better to take your time on your first day giving medication and not make an error than to just rush into it and make an error. Because at the end of the day, you're looking after a human being. It's a patient. Their health and their well-being is your priority, not the pressure you're getting from next door. Of course, you don't want to spend 10 hours of doing that now, but take your time. I feel like what would really help is asking your manager or somebody who's been there for a while, and just ask them, just give me a quick run through where the medications are kept. So that way you have an idea of where things are. So for example, you can just ask, and then they might say, on the left there, that's all the stomach tablets, and then they're all blood pressure tablets, they're all epileptic tablets, and then here are patient individual tablets. And that, listen, that will stand to you if you can have that courage to just ask. Listen, you're gonna be okay, you're gonna be fine. You'll be able to look at that trolley and be like, game on, let's go. Let's go. Once you actually get comfortable with giving the medications, kind of start feeling like, yeah, I'm getting this, like, bring it. So listen, you'll be fine. You'll be fine. I feel like if there's something that you're really afraid of on your first day, just verbalize that to your manager, verbalize it to your mentor. Go ahead and ask. There's no such thing as a silly question. I was always told this by my teachers. There's no such thing as a silly question. You're better off looking silly and asking a question and getting it than making a mistake, because 90% of the time when you ask a question, there's somebody else in the room thinking the same thing, probably looking for the same thing, trying to figure out the same thing. So never be afraid to ask a question. Seek help. You cannot do everything on your own. If you want to be Superwoman or Superman, you're going to soon realize that Superwoman can't manage on his or her own in hospital. You need to be able to ask for help and actually accept the help also when it's given to you. As the day goes by, communicate with the multidisciplinary team. Know how the phone works using a bleep, or you can just call directly. Also important, know the arrest call number for in case someone has a cardiac arrest. It's important that you know that, because you don't want that to happen to you on your first day and you just don't know. That is my advice for you on your first day. Listen, everyone has a first day. It is the start to a career. It's important that you guys enjoy it. Take the moment to let it sink in. Learn to appreciate your job. Obviously, I can't go without saying that these times are hard for all the nurses. I really do feel for all the junior nurses going in such a difficult time with this pandemic. Make sure you gear up really well, PPEs, adhere to the policy of your hospital, and yeah, like, give it your best shot and you'll be fine. You'll be fine, honestly. Any ideas what type of videos you guys want to see, just comment down below. Yeah, and that is it. Philippians 4 verse 6, it says, be anxious for nothing, but in everything, by prayer and supplication, let your requests be made known to God, and the peace of God will guard your hearts and minds through Christ Jesus. Thanks for watching. Stay safe, stay blessed. Bye.